we use. This booth has been built and designed by Dr. Williamson Chea, and he has distributed these to some of the places that treat COVID patients. So the healthcare worker would stand behind here, thanks to Dr. Chea, and we would get the swab from whoever our assistant is. Usually it's a nurse. She stands in the distance while we put the swab in the patient's nose, okay? And we collect the sample, all right? And so a booth like this provides total safety because this is plexiglass and there's absolutely no contact with the patient. And when we actually do insert the swab, even if there is aerosolization of the viral particles, the physician is totally protected because he's behind this protective glass. It's very simple, very simple. It's like a glove. We've swabbed with this. If you notice, the end of this is sort of like serrated, and this one here is smooth, so there's no problem grasping the swab. And if you look, the dexterity is very, very, very normal, and so there's no problem you know, using like a pincer grasp to manipulate the swab and then insert it in the patient's nose to get a sample. So this is very, very simple.
These booths were the creation of consultant surgeon Dr. Williamson Chea for the protection of all healthcare workers involved in the testing phase. He says he was inspired by online images.
Essentially what this does is that the person doing the test can be inside the booth and not be affected by any aerosol spray that the patient may produce when you do swab the patient. So behind that plexiglass is sort of, you blocked and protected from any spray. And the person puts his arms through these long gloves here, and it does the swab, and then they can put the swab in the media and then bag it and package it and have it sent off to the laboratory. So then after that person is being swabbed, then they could spray this down with a disinfectant and go on to the next patient. What that does is saves persons putting on the PPEs, which are one, expensive, and two, it saves PPE for when we need them. So in essence, it serves dual purposes.
He also designed and built an intubation chamber and some other helpful safety equipment.
That essentially helps to intubate patients and again prevent aerosolization of the spray when you intubate it. So, and I also did some hoods for the centrifuges in the lab, as well as what we call a hood for during the surgery. Mm-hmm. But in addition to all of this, I must put a little plug in. We have a lot of volunteers who made these types of masks. They're called mask angels, and they made over 1,300 masks, and we've distributed them throughout the community. Hospital staff, physicians, nurses, patients. So we've done quite a bit.
On the inside of the South Beach Clinic, nurse in charge Tamika Knowles is a part of the team working on